This is Dr. Jayanti Ravindran, and today I will be discussing about hair transplant in women. So, women usually present with few specific conditions for hair transplant. One of the common presentation is wanting to lower the hairline. So, women who have a broad forehead and they want to reduce the forehead size, they are one of the ideal candidates for hair transplant. Second commonest cause for hair transplant is what we call female pattern hair loss in women. Just like male pattern hair loss, female pattern hair loss is also hormonal induced, and hence the hair at the back of the scalp is not affected by this condition. Rarely, hair transplant is also used in women who attain some road traffic accident, as well as if they attain some burns in the scalp and there is a scar area in the scalp. These scar areas can also be very well covered with hair transplant. In earlier days, we used to use tissue expansion, and then we expand the area of scalp with hair bearing scalp and then relocate to the scar areas. While that procedure still can be done in extensive areas, but if there is enough donor area, usually hair transplant is a good procedure even in areas of scars in the scalp. Now, before we venture into hair transplant for women, it's very important to identify the cause for hair loss in women. Most of the time, women think that hair transplant is a solution for hair loss. That hair transplant is not a treatment for hair loss. Hair transplant is a treatment option to restore hair in the areas where hair has been lost in female pattern hair loss. So, female pattern hair loss usually begins in the partition line and then it progresses. There is a grading for it. We identify, and this female pattern hair loss is usually not reversible. Because it is not reversible, it is very important to identify the condition at a very early age. It's important that we identify a female pattern hair loss from a diffuse unpatterned hair loss. Now, what is the difference between these two conditions? In diffuse unpatterned hair loss, the side and back of the hair scalp, where the hair roots usually do not have the receptors for DHT and thereby not influenced by DHT to miniaturize and fall off, can also be affected. So, diffuse unpatterned hair loss has to be differentiated from a female pattern hair loss in a woman before we jump into hair transplant. So, when a woman presents with hair loss, we have to differentiate these two factors by a scalp biopsy. So, we take a biopsy from the areas where women have lost hair, and we take a biopsy from the back or side of the scalp. We, through histopathology studies, we differentiate, we confirm the diagnosis, and only then plan for a hair transplant. Statistics show more than 40% of women, by the time they reach 50 years of age, they show female pattern hair loss. So, less than 45% of women reach 80 years of age with a scalp full of hair. So, it's very important that we identify women who suffer from female pattern hair loss at an early age and treat them. If we treat them, definitely we can delay or slow or stop the progress. But once you reach an advanced grade of female pattern hair loss, it is very difficult to reverse by medical treatment. In such situation, hair transplant becomes the only solution. The process of female hair transplant is just the same as a male hair transplant. Some of the hair at the back is trimmed, a small area from where the grafts could be taken. So usually this area where we trim is hidden by the remaining hair, and so it's not noticeable during the procedure. And then we harvest the grafts just like we harvest in for male hair transplant, and then it is implanted in the areas where there's baldness. Coming to hair transplant in female pattern hair loss, the procedure involves trimming of about 10 by 10 centimeters of scalp hair at the back. So when you trim the hair at the back, The hair above that and below that actually covers that area. So there is no need for you to wear a wig in order to conceal the donor area. We do the procedure under local anesthesia with some IV sedation. We adopt FUE or follicular unit excision technique, whereby we don't cut any skin. We just pluck or punch out the individual grafts and thereby select the best quality grafts from the back and transplant them in areas where you have lost the hair. So usually there's not much of a pain, or our clients do not complain of any significant discomfort. There is some visibility in terms of the procedure, the donor area and the recipient area. If someone has to look into your scalp, yes, those areas will be visible for a period of 2 weeks. The donor area can be well covered with your hair above and below the areas that is trimmed for harvesting the graft, whereas the recipient area is usually covered with your native hair. So after about 2 weeks, the donor and recipient area can well be covered with your native hair and it's not visible. The hair that is planted does not grow the next day, so you'll have to be patient for a period of 3 to 6 months. At 3 months, the hair starts to regrow, and hair grows at the length of 1 centimeter per month, and so full growth is seen at the end of 6 to 8 months. You can get about 2 inches of hair growth. So in women, for it to be aligned to the rest of the hair, it would take about almost a year and 18 months. And another important question that most women want to know is, once you pluck the hair from the back, that is the donor area, will that graft grow back? Be it for men or women, the number of follicles in the scalp is fixed once you are born. So even if you lose some hair and we harvest some graft from the back and transplant in the front, those follicles do not grow. So because if that is the condition, then we can keep repeating hair transplant every now and then and replace all the hair. So please, this is very important for you to understand that hair transplant is redistribution of hair follicles, and it is not, you're not replacing hair from the back to the front and then the back hair regrows again and then we can replace that again and again. So it's very important that hair transplant is redistribution of hair growth. So it's important to confirm the diagnosis and not waste the graft before we plan for a hair transplant procedure in women. But it's a very safe procedure. The results are very rewarding when it's done in very specific conditions like female pattern hair loss with established hairs of bald areas, as well as if women desires to lower the hairline.